This patient presented with abdominal pain, and this is a case of contained perforation of sigmoid colon. How do you identify sigmoid colon? If you see in the left side of the abdomen, there is this loop of bowel. This is descending colon. And if we continue tracing it down, it continues as sigmoid colon inferiorly. And this is the part where it becomes sigmoid colon. And then the sigmoid colon goes back and continues inferiorly as rectum. Now, looking at the sigmoid colon, compared to the other part of bowel, you can see there's this mild thickening of the wall of the sigmoid colon right here, very subtle increase in thickness. And right next to the sigmoid colon, you see there's this area of heterogeneity, fat stranding, and areas of air in it. And this air is seen tracking along the posterior wall of the descending colon. All of this air is tracking in the retroperitoneal space. As we know, the descending colon is retroperitoneal structure, and this air is tracking along the retroperitoneal space along the descending colon. If you go back down here around the sigmoid colon where there is this localized area of air and some heterogeneous density, this is the area of perforation. To look at it better, it's important to change the window to lung windows. And in the lung windows, you can see material there. So this is all stool that is outside the loop of sigmoid colon here. Better seen on the lung window right there. So this is perforated bowel, and we think this is contained perforation because there is no free air in the abdominal cavity. So if there is any free air in the peritoneal cavity, it should rise up, and we don't see any free air. All we see is air within the loops of bowel, which is normal. But we do see air here around the sigmoid colon, and that is taking along the retroperitoneal space. So these findings are consistent with a contained perforation of sigmoid colon without any evidence of abscess formation, and this is likely secondary to underlying diverticulitis. This is the collection.